Good afternoon. Welcome to the Dawning Phoenix blog. I'm Dawn Echols, a licensed professional counselor in Gainesville, Georgia. I'm the owner and executive director of Dawning Phoenix, a clinical counseling, life coaching, and conflict resolution private practice. Today I want to talk about anxiety. Anxiety is a very common disorder is the clinical term we use. People would say it's a common problem that they have. It is common because I've seen it in as many as 30% of college students, freshman college students that I've taught psychology to, and that is every single class without fail. And it's a very common problem that people come to therapy for. In therapy, when we talk about anxiety, we talk about it from a couple of different perspectives. We talk about it from a cognitive behavioral therapy perspective, often called CBT among practitioners. And that means we examine the thoughts that can make anxiety worse, and we look at behaviors that might help contribute to reducing the symptoms of anxiety. Anxiety can be considered a very old as well as a very modern disorder. It's very old in the sense that it is rooted in what people often describe as fear and worry. You can think of anxiety as being a danger signal that just won't turn off. And danger signals are what's caused fear in human beings. It's one of the quickest, if not the quickest, emotion that the brain experiences. It's the fastest signal to the human body, and it activates the sympathetic and parasympathetic nervous systems incredibly quickly in order to mobilize resources. And the reason it does that is because ancient humankind needed those danger signals in the form of fear to save their lives. If not, they might have gotten eaten by bears or lions or some other danger that was life-threatening, that was lurking out there. Today we have more subtle symptoms of danger, and sometimes they can be more chronic. And then in anxiety, it can be where with those volumes turned up, every experience can be distressing, and it's not possible to turn it down for the person who suffers it, or they don't know how. And it feels as though every signal coming into the body is coming in as a danger signal. And so it really taxes the sympathetic nervous system, and it can come out. And that's the reason people often express it more often than maybe some of the other disorders that you see, is because it has physical symptoms. It can be shortness of breath, stomach aches, butterflies in the stomach, cramps, ulcers, headaches, neck tension, eye twitches, all kind, just tenseness all over the body, sleep disruption, sleep disturbance, sudden awakening, inability to go back to sleep, nightmares. These are just a few of the things that might describe what people with anxiety might experience. And anxiety has multiple different kinds of ways that it presents in a clinical setting. And a counselor can help you figure out exactly which one is yours, and it may not matter which one as long as you can get help reducing your symptoms. So for most of us, modern world can be very chaotic, and it can almost be anxiety producing. And in that sense, we all are bombarded with noise. So what we do when you come in with anxiety in a counseling setting is we first start looking at behaviors. That's the easiest thing we can start to address. We start looking at ways of helping the sympathetic nervous system calm itself down, and we give you strategies on how to do that. The second thing we do is start examining thoughts. What thoughts perpetuate that constant obsessive train that people describe of persistent worries that just won't shut up, even though they may talk back to them in their head and say, I know that doesn't make sense. I know that's not really rational. That probably won't happen, but it shouldn't happen, but if it does. So instead of it being kind of a backup plan, it can take on its own form of irrationality, so to speak. I don't really like to use the term irrationality in therapy. We can call it illogical because all of us sometimes have illogical thoughts or beliefs. Sometimes we have random things that we go, where'd that come from? So the illogical thoughts I like to refer to as those that started off rational. The danger signal is rational in historical context and in danger context. We need to pay attention to those senses of fear. And that's what creates that struggle for a person with anxiety, is because they don't want to turn off the good signals that are telling them to be careful. You should be afraid and not jump off the Eiffel Tower. You should be afraid and not jump off the Empire State Building. You should be afraid and not get too close to the edge of a cliff. It's okay to go look at the edge of it, but not get so close that you run the risk of falling off. So this is kind of what we talk about because a person who's suffering with those kind of things have those kind of fears, and they say, I don't even know where they're coming from. And so we examine thoughts and we say, okay, let's come back with a way to work towards that and to change self-talk. I did a interview with Dr. Bill Lampton of Championship Communication here out of Gainesville, Georgia, on self-talk. And there's a couple of videos at his website and on YouTube where we can talk about that. Well, we kind of use some of that in anxiety treatment. And then lastly, we can bring into it a form of mindfulness. And that is the sense that you kind of start to become aware of your sympathetic nervous system and using different strategies as ways of calming that down and becoming more in the present moment and less in that worry state of mind. This is Dawn Echols with Dawning Phoenix. I hope this has been helpful to you.